Hello, my name is DeCarla Gothi, and I am doing my presentation on ischemic stroke. An ischemic stroke, also known as a brain attack, is a sudden loss of function that results from disruption of the blood supply to a part of the brain, causing neurological deficits. Lack of oxygen to the brain that lasts longer than 10 minutes causes cerebral infarction with irreversible change. Most strokes occur when blood vessels to the brain become narrowed or clogged with fatty deposits called plaque. This narrowing blocks the blood flow to brain cells, and this in turn is called an ischemic stroke. According to Home Healthcare Now, stroke is the leading cause of long-term disability in the United States. And the main goal of treatment of an ischemic stroke is to improve perfusion and to prevent further brain injury. And this is just a picture showing how the blockage causes the ischemia, which is this part right here. Some modifiable risk factors are diabetes, dyslipidemia, excessive alcohol, hypertension, obesity, smoking, and also sedentary lifestyle. The typical signs and symptoms of a stroke would be your facial drooping, arm, face, or leg weakness, difficulty speaking, impaired judgment, sudden severe headache without a cause, trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance, or coordination. So my patient that I had the pleasure of taking care of at Piedmont Henry was a 70-year-old black male. He presented with left facial droop, with left-sided weakness, and also slurred speech. His admitting vital signs were as follows. His BP was 234/107, pulse rate of 91, temp 98.2, respirations 27, and he was satin 98% on room air. He stated that his BP meds were deceived by his primary care physician. He also states that the night before he was tired and fatigued before going to bed, but had no slurred speech. He reported that he had intermittent left lower extremity weakness along with numbness, tingling of the same extremity for the past 2 days. And this is just showing the signs and symptoms of a typical brain attack. Your headache, your mental changes, aphasia. Some may experience respiratory problems. Cough, swallow reflex may be decreased. They may experience seizures, incontinence, hemiparesis, or hemiplegia. They may have problems with hypothermia, emotional lability, visual changes, vomiting, hypertension, apraxia, all of the above. The textbook versus my client. The textbook stated that with stroke, you will have facial drooping. My client had left-sided facial drooping. Weakness, he also had weakness, difficulty speaking. He had slurred speech, but not necessarily difficulty. He did have numbness to one side of his body along with the tingling. His admitting diagnosis was facial droop and hypertensive emergency. Some of his abnormal labs were his potassium, which was a little low at 3.3, calcium at 10.4. His glucose sugar was elevated at 177. Cholesterol and LDLs were also elevated. At Piedmont Henry, and probably more than just Piedmont Henry, have the permissive hypertension. This is when they allow the blood pressure to be elevated for the first 24 to 48 hours to decrease further complications of a stroke. They give IV labetalol per protocol if the BP is greater than 220/110. They check their lipid level to determine the causative factors. They check MRI brain, carotid Doppler ultrasound. They also do an echo to rule out stroke. They replaced his potassium per protocol due to his hypokalemia, which was 3.3. The norm is 3.5 to 5.5. They monitor him on telemetry to check for hypokalemia or related to the hypokalemia. They continue with the aspirin to prevent further ischemic episodes. They checked his calcium because of the hypercalcemia. They also do a swallowing screen done before they take anything by mouth. Also, IV TPA is an essential treatment for patients with acute ischemic stroke, but it's also time sensitive. It must be given within 3 hours of a stroke. And this is just more on permissive hypertension, and it tells you why they allow the blood pressure to stay elevated after an ischemic stroke. And it states, elevated blood pressures generally should not be treated in the pre-hospital setting. During an ischemic stroke, the brain experiences decreased blood flow to the area of ischemia because of loss of vasoregulatory capability. Thus, the brain relies on cardiac output and mean arterial pressure, which is often the cause of an elevated blood pressure. Lowering the blood pressure may decrease cerebral perfusion and worsen the ischemic damage. Optimal blood pressure management is determined during the acute hospital phase based on treatment candidacy. For non-treatment eligible candidates with severe BP greater than 220/120 and no comorbidities, it is unclear if the BP should be lowered within the first 72 hours. Therefore, it is reasonable for the nurse practitioner or healthcare professional not to treat an elevated BP during the pre-hospital phase. They also recommended PT, OT, and ST to evaluate related to his slurred speech and left-sided weakness. He was also type 2 diabetic, so they gave him diabetic education due to his new diagnosis of type 2. He had an A1C of 8.7 and was placed on a diabetic diet along with sliding scale while admitted to the hospital. They recommended weight loss related to his class 1 obesity. Some emotional aspects. My client was kind of a naturalist. He didn't believe in taking medication. He believed in, doing things the natural way. But his family, on the other hand, understood that medication was best for him at this time related to not causing any more damage to the brain and decreasing his risk of having another stroke. So they asked the physician to talk with the patient about the importance of the medication without letting him know. They asked him to. The physician did the opposite and told the client that his family asked him to talk to him about the medication. This caused the client to get upset and caused his BP to rise even more. The client got upset with his family and asked him to leave. The nurse and I spoke with him and his family, and the client agreed to take the medication, and it resolved the issue. So they were able to come to a mutual agreement about medication. And this is just my concept map. The nursing diagnosis I chose was ineffective cerebral tissue perfusion related to the interruption of blood flow, as evidenced by changes in motor language deficits. Also, deficit knowledge related to development of preventable complications, ineffective coping related to situational crisis. And this is just the teaching, the labs, treatment, and discharge. Improved patient care is one of the QI considerations I chose. Early recognition of a stroke will limit the extent of damage to the brain and increase the chance of survival and long-term disability. Nurses' knowledge of the signs and symptoms of a stroke and treatment is vital. Early assessment and rapid treatment are critical to saving brain cells. Some of the teaching was medication adherence, diet modification, and rehab needs. This is just the lesson plan I went over. Talked to him about how to prevent a stroke and things to do when you do notice symptoms, to call 911 immediately and take your medication and adhere to any kind of diet that was recommended. We also gave him a stroke booklet that gave step-by-step of things to do and how to prevent, and the comorbidities he had that caused him to have a stroke. Upon discharge, Piedmont Henry requires that all patients that has had a stroke have an order for a statin and an antiplatelet. My client was discharged after a 2-night stay in the hospital. On admission, his BP was extremely elevated, so after the doctor and nurses were able to get his blood pressure down to a safe level, he was discharged. He plans to live with his son while he's going through rehabilitation. The end.